What if I told you that one of the most private things you do, something you've probably done for decades, could be silently shaping your prostate health every single day? Even 80s who've quietly asked me the same thing behind closed doors. Doc, is my daily habit hurting me? And the answer? It's not that simple, but it's far more important than you might think. Let me be clear. This isn't a video about shame. This is about truth, hope, and taking control of your health. You see, I've worked with thousands of men over the past 30 years. Men in their 60s, 70s.
Than you might think. Masturbation, yes, let's name it out loud, is something most men never really talk about, especially as they age. But what if I told you it's not just a release? It's a signal, a window into your prostate, your hormones, your blood flow, and even your future energy levels. You're not broken. You're not doing anything wrong. And no, you're definitely not alone. What you do deserve is clarity and dignity. So let's explore what's really going on, because what I'm about to share might just change the way you think about your body forever. Let's talk about what actually happens to the prostate as you age. Let's strip away the mystery for a moment and talk honestly. What is the prostate and what's really happening to it as you get older? Picture this, a small walnut-sized gland tucked just below your bladder. It's quiet, rarely makes headlines, but plays a vital role in your sexual health, urinary function, and hormonal balance. And as you hit your 60s, that little walnut, it starts to swell. Naturally, it's called benign prostatic hyperplasia, or BPH. Now, this isn't cancer. It's not even dangerous at first, but the symptoms, they're frustrating, slower flow, nighttime trips to the bathroom, that annoying feeling of never fully emptying your bladder. And here's what many men don't realize. Your hormones are shifting too. Testosterone drops, estrogen creeps up, and your prostate becomes more sensitive to daily stress, diet, even how often you ejaculate. One of my longtime patients, Carl, 67, told me, "Doc, I thought these changes just meant I was getting old and useless." But he wasn't. He was just uninformed. The truth, aging changes your body, but not your power to influence it. Now that we've opened the door, let's step into the real question. What does daily masturbation actually do to all of this? Here is the fully developed script for. So, what does masturbation actually do to the prostate? Most men never connect the dots. But here's the twist. Every time you ejaculate, whether through sex or solo, it sets off a cascade of muscle contractions, especially in the prostate and pelvic floor. That movement, it's not just release. It's like a natural cleanse for the gland. In fact, researchers from Harvard found something startling. Men who ejaculated 21 times or more per month had a 33% lower risk of prostate cancer compared to those who did it less than 7 times. Shocking, right? It turns out, regular ejaculation may help flush out old seminal fluid, reduce inflammation, and promote better circulation. It's like giving your prostate a reset button, but I want to be clear, this isn't about performance. This is about function, and it's especially important after 60, when blood flow slows and tissues can become congested. Your body needs movement, even at the cellular level. So the next time you wonder if that daily habit is meaningless, remember, it might just be doing more behind the scenes than you ever imagined. But can it ever go too far? Here is the fully developed script for, but wait, can it be too much of a good thing? Now here's the part most guys don't expect. Yes, even something healthy can become too much. I once had a patient, Ron, 62, widowed, retired. He told me, "Doc, I'm alone a lot. I use it to relax, fall asleep, kill time. But lately, I just feel drained." His story's not rare. You see, when masturbation becomes mindless, done out of habit or boredom, it can desensitize your brain's reward system. That's dopamine at play. The same spark that once made things feel good. It starts fading. Erections aren't as strong. Sensitivity drops, and mentally, you feel disconnected. And here's the kicker. If you're using it to numb stress or avoid loneliness, it can backfire, leaving you more anxious, more fatigued, even less motivated. This isn't about guilt. It's about awareness. Ask yourself, do I feel better afterward or just more tired? That question alone can tell you a lot about whether your body is asking for connection or simply overstimulation. The goal isn't to stop, it's to listen. So, what does healthy prostate, supportive self care actually look like? Let's walk through it step by step. The healing middle ground. How to masturbate for prostate health. Here's the truth most doctors won't say out loud. You can masturbate in a way that supports your prostate and your energy, your mood, even your sense of self. It's not about quitting, it's about shifting from automatic to intentional. Start by slowing down, take a few deep breaths, get present in your body. You're not in a race, you're tuning in. This is a time to feel, not to rush. Next, notice your pelvic floor, the group of muscles that contract during orgasm. Gentle Kegel exercises like tightening and releasing those muscles a few times after ejaculation can help improve circulation and reduce pressure in the prostate. Some men even find that placing a warm towel across the lower belly or perineum afterward eases inflammation and tension. And here's a powerful shift. Skip the screen. Porn overstimulates your brain. Try imagination, memory, breath. It rewires connection back into your body instead of pulling it out. Ron, remember him, once he slowed down, tuned in, and changed his routine. He said, "I don't just feel relief now, I feel restored." You deserve that too. So, how does this tie into your bigger picture? Your long-term prostate health and future freedom. Let's bring it all together. Absolutely, here is the fully developed script for the bigger picture, beyond the bedroom into your future. Masturbation is just one small part of a much bigger picture. Your entire body, your future freedom, and how you age from this point forward. If your prostate is inflamed, your erections are weaker, or your bladder's acting up, it's not just age, it's a sign your body is whispering for change. What you do outside the bedroom matters just as much. Think more anti-inflammatory foods like tomatoes, green tea, pumpkin seeds, staying hydrated, simple pelvic stretches or short walks to keep blood flowing, natural support from supplements like zinc or saw palmetto. One of my patients, David, 68, started making small shifts. He cut down on nightly habits, added a few natural foods, started doing gentle Kegels in the morning. 3 months later, he told me, "Doc, I sleep through the night now, and I feel like me again." That's the goal, not perfection, not some fantasy of youth, but a strong, connected, healthy version of you in this chapter of life. You don't need to give things up. You need to reconnect with what your body's been asking for all along. Let's close with one last truth about dignity, healing, and why you are far from done. You deserve truth, not gimmicks. Here's what I want you to remember. Loud and clear, you are not broken. You are not alone. And you don't need to fall for gimmicks, pills, or silent suffering to reclaim your health. Your body is still speaking to you, and every habit, yes, even the quiet ones, can either move you towards strength or away from it. This video wasn't about judgment. It was about honesty, about cutting through the noise and finally giving you real answers without shame. So if something resonated today, if a light bulb went off or you felt like, yes, that's what I've been wondering, then you're already on the path forward, because the first step to healing, it's not a supplement, it's not surgery, it's awareness, and you just took it. If you found this valuable, I invite you to join us, subscribe, share this with a friend, and stay tuned. We're talking about everything no one else will, but that every man deserves to understand, because you're not at the end of anything. You're just getting started with clarity, confidence, and control. Let's talk porn, numbness, and real connection. Let's take a moment to talk about something that's quietly affecting millions of men, especially after 60. And almost no one brings it up. Porn. Now, this isn't about morals or shame. It's about what it's doing to your brain and your body. See, when you were younger, arousal came from life, from the real touch of a partner, from the build-up anticipation, the emotion. But when you flood your brain daily with high-speed artificial stimulation, your body starts to tune out. It stops responding to real cues. One man told me, "Doc, I can watch anything and feel nothing. It's like I'm chasing intensity but losing myself in the process." That's not dysfunctional, that's disconnection. The good news, you can rewire that. Start simple. Try going a few days without screens. Use memory, imagination. even just breathing deeply into your body without judgment. At first, it might feel awkward, but then something beautiful happens, sensation returns, emotion reconnects, awareness sharpens, and over time, so does your natural desire. One powerful practice I often recommend: slow touch with intention, with presence, not to reach the end, but to feel again, because real connection starts with you, with knowing your body, listening to it, and honoring it without distraction. Your sexuality isn't gone, it's just waiting to come home.